Tonight, Rady Children's Hospital is seeing a spike in sick children. Yeah, the number of visits to the department has almost doubled in the past 2 weeks, and so has the wait time. CBS 8's Jenny Day is live in the newsroom with advice that the experts told her today. Jenny?
Yeah, good evening to you both. So if you are thinking about taking your kid to the ER, you could be waiting more than 6 hours, really all depending on the emergency. Even at last check, urgent care wait times were incredibly long as well. Around 5 o'clock, it was about an hour, but at last check, some patients are waiting up to 4 hours just to be seen. The rise in patients combined with a strained staff forced the hospital to issue a warning on social media, letting people know about the higher than usual number of people needing care. Doctors at Rady Children say nationwide our immune systems are struggling a little bit after living in a COVID bubble for 2 years. So with more people resuming normal activities, things like the flu and RSV are taking even the tiniest patients out of commission. The most common symptoms right now are runny nose, fever, and shortness of breath. The busy season for pediatric cases doesn't typically start until late November, but for example, right now the ER is seeing 300 to 400 patients a day compared to the normal 200 to 300.
Kids are always going to be kids, and so there's also kids that have appendicitis, and also which is the news is featured. There's also behavioral health crisis that's going on as well, and so it's a perfect storm right now, and so we really have to make sure that we're using our resources appropriately and trying to meet the kids who are the sickest and who have the highest needs first and foremost.
Yeah, and sadly, Rady's has seen a 300% increase in behavioral health calls since the start of the pandemic. Crisis measures are not currently in place, but more resources are being put in the emergency department right now. And we know it can be so hard to decide whether to take your kid in or just ride it out at home. So I'll put a link to the wait times and a really helpful chart on CBS8.com that kind of breaks down when to go to the ER, urgent care, or just get in touch with your primary care doctor. And a lot of it really comes down to the basics. Doctors say get your vaccines, wash your hands frequently, and stay home if you're sick. Live in the newsroom, Jenny Day, CBS 8.
Good advice. Thanks, Jenny.